Hey guys, today we're about to explore a topic that's crucial to our health and well-being: hand numbness. Have you ever wondered why your hands fall asleep or feel tingling? This video is an informative and enlightening journey into the top 10 causes of this uncomfortable hand feeling. Follow every detail carefully, because understanding these causes can be the key to improving your quality of life. Furthermore, I invite you all to subscribe to our channel, as we are dedicated to bringing you valuable content for your health and well-being. Don't miss the opportunity to stay up to date with this important information that can directly impact your daily life. Let's together unravel the mysteries of numbness in our hands and learn how to take care of our health effectively. 1. Bad posture. Poor posture is a common cause of numbness in the hands due to nerve compression. When we hold our wrists in flex positions for long periods of time, such as when working at a computer or sleeping with our wrist bent, we can compress the median nerve that runs through the wrist, resulting in symptoms of numbness and tingling in the hands. Prolonged compression can restrict blood flow and damage nerves, leading to chronic numbness. Therefore, it is crucial to maintain an ergonomic posture during daily activities, take regular stretching breaks, and adjust hand position to prevent nerve compression and its unpleasant effects. 2. Carpal tunnel syndrome. Carpal tunnel syndrome is a significant cause of hand numbness. This condition results from compression of the median nerve located in the wrist, often due to repetitive hand movements such as excessive typing or repetitive manual labor. Narrowing of the carpal tunnel creates pressure on the nerve, impairing its function and causing symptoms such as numbness, tingling, and weakness in the hands and fingers. If left untreated, carpal tunnel syndrome can worsen over time, becoming chronic and debilitating. Treatment generally involves rest, use of wrist orthoses, physical therapy, and in severe cases, surgery to relieve pressure on the median nerve, highlighting the importance of early diagnosis and prevention, especially in occupations with a high risk of developing this condition. 3. Cervical disc herniation. Cervical disc herniation is one of the possible causes of numbness in the hands, resulting from compression of the nerves in the cervical spine. When an intervertebral disc in the neck region herniates, that is, bulges out of its normal position, it can put pressure on nearby nerves, interfering with nerve communication and causing symptoms such as numbness, tingling, and weakness in the hands and arms. This condition can be triggered by injuries, natural wear and tear on the spine, or even poor posture over time. Treatment usually involves physical therapy, pain-relieving medication, and in severe cases, surgery to relieve pressure on the affected nerves. Early detection and appropriate management are essential to prevent long-term complications and restore hand function. 4. Neck or shoulder injuries. Injuries to the neck or shoulders are a potential cause of hand numbness, often resulting from accidents or trauma affecting the cervical region. When injuries occur in these areas, direct or indirect damage to the nerves that innervate the hands can occur. This can cause symptoms such as numbness, tingling, and weakness in the hands. In addition to accidents, activities that overload the neck and shoulder muscles, such as incorrect weight lifting, can also lead to nerve problems and, consequently, numbness in the hands. Initial treatment typically involves rest, ice, and medications to reduce inflammation, but the severity of the injury will determine the need for additional medical interventions, emphasizing the importance of immediate medical evaluation in cases of neck or shoulder injuries associated with hand symptoms. 5. Diabetes. Diabetes is one of the most common underlying causes of hand numbness due to a phenomenon known as diabetic neuropathy. This chronic condition affects peripheral nerves, including those that innervate the hands. Prolonged elevation of blood sugar levels damages small blood vessels and compromises nerve function. This results in symptoms such as numbness, tingling, pain, and loss of sensation in the hands. Strict blood sugar control is key to preventing and managing diabetic neuropathy. Additionally, medications, physical therapy, and lifestyle changes are often used in treatment to alleviate symptoms and reduce the progression of the condition, highlighting the importance of regular blood glucose monitoring in diabetic patients. 6. Vitamin deficiencies. Vitamin deficiencies, especially a lack of vitamin B12, can trigger numbness in the hands. Vitamin B12 is essential for the health of the nervous system, and its deficiency can result in damage to peripheral nerves, known as neuropathy. This can lead to symptoms such as numbness, tingling, and weakness in the hands and feet. B12 deficiencies are often caused by a diet low in foods rich in this vitamin, medical conditions that affect nutrient absorption in the intestine, or even digestive problems. Treatment involves identifying the underlying cause of the deficiency and may include vitamin B12 supplementation, dietary adjustments, and medical approaches to improve absorption of the vitamin, highlighting the importance of early diagnosis and appropriate medical monitoring to avoid neurological complications. 7. Raynaud syndrome. Raynaud syndrome is a condition that affects blood flow to the fingers, causing episodes of numbness and changes in skin color, typically triggered by exposure to cold or emotional stress. This syndrome occurs when blood vessels in the hands overreact to cold, rapidly narrowing and reducing blood flow to the fingers. This can cause numbness, tingling, and the skin on the fingers may turn pale or bluish during episodes. Although not usually a serious condition, Raynaud syndrome can be uncomfortable and impact quality of life. Prevention involves keeping hands warm in cold environments, reducing stress, and in severe cases, medications may be prescribed to relax blood vessels and improve circulation in the hands. Consulting a doctor is important to confirm the diagnosis and establish an appropriate treatment plan. 8. Arthritis. Arthritis, especially rheumatoid arthritis, is a relevant cause of numbness in the hands due to the chronic inflammatory effects that affect the joints. In this context, persistent inflammation can compress the nerves that pass through the joints, resulting in symptoms such as numbness and tingling in the hands. Additionally, arthritis can directly damage the joints in the hands, leading to deformities and reduced mobility, which can contribute to the feeling of numbness. Treatment for rheumatoid arthritis involves anti-inflammatory medications, physical therapy, and in some cases, surgery to correct deformities or relieve pressure on nerves. Adequate control of the disease is essential to minimize neurological symptoms and preserve hand function. Therefore, it is important to consult a rheumatologist for evaluation and appropriate management if arthritis is suspected as the cause of hand numbness. 9. Nerve injuries. Direct injuries to the nerves in the hands, resulting from trauma or accidents, can be an immediate cause of numbness in the hands. These injuries can range from bone fractures that put pressure on nerves to deep cuts or bruises that directly damage peripheral nerves. When nerves are affected, proper communication between the brain and hands is disrupted, resulting in symptoms such as numbness, tingling, and loss of function. Treatment for nerve injuries depends on the extent of the injury, but may include immobilization, physical therapy, and in severe cases, surgery to repair the damaged nerves. Assessment and accurate diagnosis by a physician or hand specialist are essential to determine the severity of the injury and the best treatment approach, with the aim of restoring hand function and minimizing sequelae. 10. Vibration syndrome. Vibration syndrome, often associated with workers using vibrating tools such as jackhammers and sanders for long periods, can be a cause of hand numbness. Chronic exposure to mechanical vibrations can damage blood vessels and nerves in the hands, leading to symptoms such as numbness, tingling, and weakness. This condition, known as vibration neuropathy, is progressive and can negatively affect workers' quality of life. Prevention is key and may involve the use of protective equipment such as anti-vibration gloves, regular breaks, and adequate training on how to safely handle vibrating tools. Additionally, it is important to undergo regular medical evaluations to monitor hand health and identify symptoms of vibration syndrome early in order to implement appropriate preventive and treatment measures. In conclusion, hand numbness can be caused by a wide variety of factors, from postural problems and injuries to chronic medical conditions like diabetes and arthritis. Understanding these possible causes is crucial to recognizing symptoms, taking preventive measures, and seeking help when necessary. However, it is essential to emphasize that self-medication or self-diagnosis are not safe practices. Each case of hand numbness is unique and may require an individualized approach. Therefore, when experiencing persistent symptoms of numbness, it is highly recommended to consult a physician or hand specialist for proper evaluation, accurate diagnosis, and development of a personalized treatment plan. Early detection and appropriate treatment can help alleviate symptoms, prevent complications, and ensure a better quality of life. Therefore, seeking medical advice is the most important step in dealing with hand numbness effectively and safely. Thank you very much for watching this video to the end. Sharing knowledge is a powerful way to help those in need. If you found this content informative and valuable, please share it with your friends, family, and colleagues. This way, together we can disseminate important information about hand numbness and help more people understand the causes and necessary care. Don't forget to watch the next video related to this topic that will appear on your screen. We will continue to bring educational content to enrich your journey of knowledge and healthcare. Thank you for being part of our community.